Myth: heart failure means your heart has stopped working.
This is not true. If an individual's heart stopped working completely, that would be considered cardiac arrest. Rather, heart failure is simply when the pumping action of the heart is not strong enough to pump blood around the body and meet the body's need for oxygen sufficiently. And because the heart gets progressively weaker, there can be a backlog of fluid that forms in the extremities or in the lungs depending on the type of heart failure that is occurring. For more information and more detail on what heart failure is and what types of heart failure there are, please feel free to check out part 1 of our congestive heart failure series on Dr. Curnew's YouTube channel seen here. So, while heart failure sounds like the full stopping of the heart, it rather refers to the weakening and decrease of function of the heart muscle.
Busted!
Myth: you should take it easy if you have heart failure.
Patients actually don't necessarily have to take it easy. They can still push themselves and do the things that they love, work, and exercise, just as long as their symptoms and condition do not worsen. If whatever they may be doing is physically or mentally stressful, patients may experience symptoms of heart failure, such as shortness of breath, chest pain, and irregular heartbeat or heart rate. In this case, they should rest and not continue to push themselves. Many patients are still able to remain active and work just as long as they manage their condition properly and rest accordingly without experiencing symptoms.
Busted!
Myth: you can't prevent heart failure.
Many lifestyle and diet changes can actually be made in order to help improve your health and prevent the development of heart failure. Things like avoiding or stopping smoking and decreasing alcohol and caffeine consumption, while also exercising and improving diet, can help prevent heart failure. It is encouraged to avoid unhealthy saturated and trans fats, sugar, cholesterol, sodium, and red meats. Instead, focus on meals with plenty of fruits and vegetables, whole grains, nuts, low-fat dairy, and lean sources of protein such as chicken without the skin. Sources of healthy fat also include fish, avocados, and foods with olive oil. Also, try to decrease the stress in your life and manage any other conditions you may have that may contribute to the development of heart failure.
Busted!
Myth: heart failure can't be treated.
Heart failure can definitely be treated. Patients with heart failure can take medications such as ACE inhibitors, ARBs, and beta blockers, among others, to treat their condition. The medication a patient uses depends on their specific condition and what works well for them. For others, surgery and special devices may be required, such as a biventricular pacing device, which could be implanted and help synchronize the contractions of the ventricles of the heart through the use of electrical impulses, thus improving the pumping ability of the heart. Implantable cardioverter defibrillators are another device implanted under the skin that sends electrical impulses to the heart when it senses an irregular rhythm and administers a shock to return it to normal rhythm. It is also important to follow all other dietary and lifestyle changes mentioned before that prevent and slow the progression of heart failure.
Busted!
Myth: only older people get heart failure.
While age is a big risk factor, younger folks can also get heart failure. A 2013 study in the Journal of the American College of Cardiology investigated heart failure in young adults and found that obesity may actually play a large role in younger cases of heart failure. Younger patients with CHF were more likely to be obese than those over 60 years old. Additionally, damage to the heart muscle can actually thin and weaken the muscle, which may contribute to the development of heart failure in young adults. This is called dilated cardiomyopathy, and it's a condition in which the left ventricle muscle is enlarged and weakened and is closely associated with cases of young heart failure. Family history of heart conditions can also increase the risk of heart failure in young adults, especially in genetic conditions that cause dilated or hypertrophic cardiomyopathy. These both cause the heart to decrease in its pumping capacity, but in different ways. Dilated cardiomyopathy causes the heart to weaken and thin, as we discussed before, while hypertrophic cardiomyopathy causes the heart muscle to thicken to the point where it impairs its filling function and cannot fill with enough blood to pump around the body.
Busted!
Myth: if I'm developing heart failure, I would know.
This is not quite true. People often have high blood pressure or hypertension without actually knowing it, hence why it's often referred to as the silent killer. Hypertension is especially important in heart failure because the high pressure puts extra strain on the heart, which may lead to the development of heart failure over time. In fact, hypertension is a component of the HFpEF score, seen here, which is a group of diagnostic criteria for heart failure with a preserved ejection fraction. Additionally, the first symptoms of heart failure usually are things such as fatigue, weight gain, and a slight swelling around your ankles, which can be attributable to a wide variety of factors outside of heart failure. This is why it's so important to monitor your heart health regularly and consistently.
Busted!
Myth: heart failure is really a man's problem. Not exactly. This is a myth. There was a study published in the European Journal of Cardiovascular Nursing, which will have the study down below in the description, that found that while men did have a higher incidence of heart failure, both sexes demonstrated a similar prevalence of heart failure overall. This means that more men develop heart failure in a specific period of time, but the overall proportion of men and women with the disease in that same period of time are the same. And this is mostly due to the fact that when women get heart failure, they survive for longer. Women also tend to be older when they're diagnosed with heart failure and actually report a lower quality of life after diagnosis than men. So as a result, heart failure should not be taken lightly regardless of your sex.
Busted!
Myth: heart failure is the same as a heart attack. Heart attack is different from heart failure because heart attacks occur when there's insufficient blood supply to your heart, whereas heart failure occurs when your heart can no longer pump blood effectively. In fact, heart attacks can eventually lead to heart failure. And to explain this a little bit more, we can take a look at our biodigital anatomy. So this is a 3D model of our heart. And if I remove some of the fat here, you can see that the heart is being supplied by various blood vessels. And these blood vessels are known as coronary vessels. And specifically, the coronary arteries deliver oxygenated blood to the heart, specifically the muscle tissue of the heart. And the muscle tissue is what allows this heart to contract. And what can happen in a heart attack is that there can be a buildup of plaque or a clot here that prevents blood flow into the coronary artery. And this can lead to decreased blood flow supplying the muscle tissue and lead to potentially muscle necrosis or muscle death. And this can lead to heart failure because now your muscle will not be able to contract as well, so your heart will not be able to pump as effectively.
Busted!
Myth: heart failure is different from congestive heart failure. Actually, heart failure and congestive heart failure are interchangeable terms. They describe the same disease process. The name congestion merely refers to the symptoms or the feeling of blockage in heart failure. And this congestion is almost like a traffic jam. Whereas in a traffic jam, you have cars that are being backed up. In the same way, in congestive heart failure, your heart is not able to pump the blood from the blood vessels that are coming into the heart very effectively. So that causes a fluid backup and therefore congested blood vessels.
Busted!